Hello everybody. Today we are going to learn all important MCQs on blood. Starting with the first question, what is the main job of red blood cells? Option A, to carry nutrients. Option B, to fight germs. Option C, to carry oxygen. Option D, to make us warm. The main job of RBC is to carry oxygen. RBC transport oxygen from the lungs to body tissues using hemoglobin. This oxygen is vital for energy production. What is the liquid part of blood called? Option A, plasma. Option B, platelets. Option C, white blood cells. Option D, hemoglobin. What is the liquid part of blood is called? Right answer is plasma. Plasma is the liquid part of blood carrying nutrients, hormones and waste products. What is the function of platelets in the blood? A, to carry oxygen. B, to fight infection. C, to help in blood clotting. D, to carry hormones. The function of platelets is to help in blood clotting. Platelets help to form clots to stop bleeding after an injury. Which blood component fights infection? A, red blood cells. B, plasma. C, white blood cells. D, platelets. Right answer is white blood cells. White blood cells protect the body from infection by attacking the germs. What is the universal donor blood type? A positive, AB positive, O negative, B positive. The universal donor blood type is O negative. O negative blood can be donated to anybody because it lacks antigens. What is the universal recipient blood type? Option A, AB positive. Option B, O negative. Option C, A positive. Option D, B positive. The universal recipient blood type is AB positive. AB positive can receive blood from all type because it has no antibodies to reject other blood types. How much blood does the average adult human body contain? Option A, 3 to 4 liters. Option B, 5 to 6 liters. Option C, 7 to 8 liters. Option D, 9 to 10 liters. The average adult human has about 5 to 6 liters of blood. The average adult has about 5 to 6 liters of blood, which accounts for roughly 7 to 8% of body weight. What gives blood its red color? A, plasma. B, hemoglobin. C, white blood cells. D, platelets. The red color in the blood is due to the presence of hemoglobin. Hemoglobin in the red blood cells binds with oxygen, gives blood its red color. What is the lifespan of a red blood cell? A, 30 days. B, 60 days. C, 90 days. D, 120 days. The right lifespan of a red blood cell is 120 days. Red blood cells live for 120 days before they are broken down and recycled in the body. Which organ produces most of the body's blood cells? A, heart. B, lungs. C, bone marrow. D, liver. Right answer is bone marrow. Bone marrow produces red blood cells, white blood cells as well as platelets. Which blood cells are the most numerous in the body? A, white blood cells. B, platelets. C, red blood cells. D, plasma cells. Right answer is red blood cells. Red blood cells are the most abundant cell in the blood, accounting for about 40 to 45% of its volume. Which type of blood cell increases during an infection? Red blood cells, platelets, white blood cells, plasma cells. Right answer is white blood cells. White blood cells, also known as leukocytes, are responsible for protecting your body from infection. Which blood component is involved in clotting? A. Red blood cell, B. Platelets, C. White blood cells, D. Plasma. Right answer is platelets. Platelets stick to the site of injury and help form a blood clot to stop bleeding. What is hemoglobin responsible for? A. Transporting oxygen, B. Fighting infections, C. Producing platelets, D. Regulating blood pressure. Right answer is transporting oxygen. Hemoglobin in the red blood cells carry oxygen from the lungs to the rest of the body. What happens when blood clots too much inside the body? A. Hemorrhage, B. Thrombosis, C. Anemia, D. Leukemia. Right answer is thrombosis. Thrombosis occurs when a blood clots from inside a blood vessel, potentially blocking blood flow. Which protein in the blood helps in clot formation? A. Hemoglobin, B. Fibrinogen, C. Albumin, D. Myoglobin. Right answer is fibrinogen. Fibrinogen is converted to fibrin during clot formation, creating a mesh that stops bleeding. Which condition occurs due to a low number of red blood cells? A. Anemia, B. Leukemia, C. Hemophilia, D. Thrombosis. Right answer is anemia. Anemia is caused by deficiency of red blood cells, leading to fatigue and weakness because transportation of oxygen to every body part is insufficient. What is the normal platelet count in a healthy person? A. 1,50,000 to 4,50,000 per microliter, B. 10,000 to 50,000 per microliter, C. 1 million per microliter, or D. 50,000 to 1 lakh per microliter. The normal platelet count in a healthy person is 1,50,000 to 4,50,000 per microliter. Normal platelet count ranges between 1,50,000 to 4,50,000 per microliter of the blood. Which blood disorder involves excessive bleeding due to lack of clotting factor? A. Leukemia, B. Hemophilia, C. Thrombosis, D. Anemia. Right answer is hemophilia. Hemophilia is a genetic disorder where blood does not clot properly due to the absence of clotting factor. What is the function of albumin in the blood? A. Oxygen transport, B. Regulating blood pressure, C. Fighting infection, D. Maintaining osmotic pressure. Right answer is maintaining osmotic pressure. Albumin is responsible for maintaining osmotic pressure for balance of fluid in blood transfusion. What percentage of blood is plasma? A. 20%, B. 55%, C. 70%, D. 80%. Right answer is 55%. Plasma makes up about 55% of the blood, providing a medium for blood cells to move through the body. Which of the following is a blood type in the ABO system? Option A, option B, X, option C, Z, option D, Y. Right answer is option A. The ABO system includes 4 blood types: A, B, AB, and O, based on the presence of antigens. Which vitamin is essential for blood clotting? Option A, vitamin C, option B, vitamin K, option C, vitamin A, or option D, vitamin D. Right answer is vitamin K. Vitamin K is crucial for the synthesis of blood clotting, preventing excessive bleeding. What does the RH factor determine? Option A, blood clotting ability, option B, blood type compatibility, option C, positive or negative blood type, option D, oxygen carrying capacity. Right answer is option C, positive or negative blood type. The Rh factor is a potential that determines whether a person has a positive or a negative blood type. What is the normal pH of a human blood? Option A 6.4, option B 7.4, option C 8.4, option D 5.4. The normal pH value of human blood is 7.4. What organ filters and removes old red blood cells? Option A heart, option B liver, option C spleen, option D kidney. Right answer is spleen. The spleen filters blood and removes old or damaged red blood cells, recycling components like iron. What type of blood cells are involved in allergic reaction? Option A neutrophils, option B basophils, option C eosinophils, option D monocytes. Right answer is option C eosinophils. Eosinophils plays a key role in allergic reaction and fighting parasites infections. Which condition results from an abnormal increase in white blood cells? Option A leukemia, option B anemia, option C hemophilia, option D thrombosis. Right answer is option A leukemia. Leukemia is a type of cancer in which the bone marrow produces an excessive number of abnormal white blood cells. What is the most abundant protein in plasma? Option A hemoglobin, option B albumin, option C fibrinogen, option D globulin. Right answer is albumin. Albumin is the most abundant protein in plasma and helps maintain blood volume by balancing fluid. What is the term for the formation of new blood cells? Option A hemostasis, option B hematopoiesis, option C hemophilia, option D hematuria. Right answer is option B hematopoiesis. Hematopoiesis is the process of forming a new blood cells primarily occurring in the bone marrow. Which blood cells carrying oxygenated blood from the lungs to the heart? Option A pulmonary artery, option B pulmonary veins, option C aorta, option D superior vein cave. Right answer is pulmonary vein. The pulmonary vein carries oxygenated blood from the lungs to the left atrium of the heart. What blood type can only receive blood from the same type? A positive, AB positive, O negative, B positive. The right answer is O negative. People with O negative blood type can only receive blood from O negative donor because they lack both A and B antigen and Rh factor. What is the main role of white blood cells, WBC? A. Transport nutrients, B. Carry oxygen, C. Fighting infections, or D. Form clots. The right answer is fighting infections. White blood cells are essential for the immune system, defending the body against bacteria, viruses, and other pathogens. Which of the following is not a type of white blood cell? A. Neutrophil, C. Eosinophil, A. Basophil, D. Erythrocyte. Right answer is erythrocyte. Erythrocytes are red blood cells, while neutrophils, eosinophils, and basophils are type of white blood cells. What is the process of stopping bleeding called? A. Hematopoiesis, B. Hemostasis, C. Hematuria, D. Hemophilia. Right answer is hemostasis. Hemostasis is the process by which the body stops bleeding, involving vascular construction, platelet blood formation, and clotting. Which of the following is a clotting disorder? A. Leukemia, B. Anemia. C. Hemophilia. D. Thalassemia. Right answer is hemophilia. Hemophilia is a genetic disorder where the blood lacks certain clotting factors leading to excessive bleeding. What is the iron containing molecule in a red blood cell that binds to oxygen? A. Hemoglobin. B. Myoglobin. C. Fibrinogen. D. Albumin. Right answer is hemoglobin. Hemoglobin is a protein in red blood cells that contains iron and binds to oxygen, allowing its transport throughout the body. Which blood disorder involves the destruction of red blood cells? A. Sickle cell anemia. B. Thrombosis. C. Hemolysis. D. Leukemia. Right answer is hemolysis. Hemolysis refers to the destruction of red blood cells, which can occur due to various conditions or infections. What is the smallest type of blood cell? A. Platelets. B. Red blood cells. C. White blood cells. D. Plasma cells. Right answer is platelets. Platelets are the smallest type of blood cells and are responsible for helping blood to clot. What is the term for low platelet count? A. Anemia. B. Leukopenia. C. Thrombocytopenia. D. Erythrocytosis. Right answer is thrombocytopenia. Thrombocytopenia is a condition where the platelets count is abnormally low, leading to difficulty in clotting. What does the A in A positive blood type represent? A. Antibody. B. Antigen. C. Albumin. D. Aorta. Right answer is antigen. The A in A positive blood type refers to the presence of A antigen on the surface of red blood cell. What is the most common blood type in humans? A positive, AB positive, O positive, or B positive? Right answer is O positive. O positive is the most common blood type found in about 37% of world's population. Which blood cell is responsible for transporting carbon dioxide away from tissues? A. Platelets. B. Red blood cells. C. White blood cells. D. Plasma. Right answer is red blood cells. Red blood cells carry carbon dioxide, a waste product of cellular respiration, from tissues to the lung for exhalation. What mineral is essential for hemoglobin to function? A. Calcium. B. Magnesium. C. Iron. Or D. Potassium. Right answer is iron. Iron is a critical component of hemoglobin, enabling it to bind with oxygen and transport it throughout the body. Which diseases causes the red blood cell to become sickle shape? A. Hemophilia. B. Thalassemia. C. Sickle cell anemia. D. Leukemia. As the name suggests, the right answer is sickle cell anemia. Sickle cell anemia is a genetical disorder in which red blood cells take a crescent shape, leading to blockage in blood vessels and reducing oxygen carrying capacity. Which blood component contain antibodies? A. Red blood cells. B. Platelets. C. Plasma. Or D. Hemoglobin. Right answer is plasma. Plasma contain antibodies which are potential that help the immune system fight off infection and foreign invaders. What is the term for white blood cell deficiency? A. Leukocytosis. B. Leukopenia. C. Anemia. D. Thrombocytopenia. Right answer is leukopenia. Leukopenia is a condition where the white blood cells count is lower than normal, increasing the risk of infection. What blood type is the rarest? O negative, AB positive, A positive, B negative. The rarest blood type is A positive. A positive is the rarest blood type, found in only about 1 to 2% of the world's population. What happens to the red blood cells when they lack sufficient hemoglobin? They carry more oxygen, they break down rapidly, they cause anemia, or they form clots. Right answer is they cause anemia. A lack of hemoglobin in red blood cells leading to anemia, which reduces the amount of oxygen delivered to tissue, causing fatigue and weakness. What is the main function of a lymphatic system, which works closely with the blood? A. Transport oxygen. B. Fight infection. C. Regulate temperature. Or D. Fight platelets. Right answer is fight infection. The lymphatic system works with the immune system to fight infection by transporting white blood cells and filtering out harmful substances from the blood and tissues. It also helps in returning excess fluid to the bloodstream. Thanks for watching, friends. Now we have completed the science MCQ blood questions. All important questions have been covered in this video. Thank you so much for joining.